Very important things and points that mentioned in this morning during the symposium for fracture as a pilon fracture and fracture in distal part of the tibia, an experience that explaining about this important fracture that was done by our colleagues from Germany and also from Israel and also from Hong Kong. So this short time that I have as a free paper explain some definition and also mention of the review of articles about the pilon fracture. Why? Because as we know that in casualty this type of fracture is very important, and in spite of any form of the treatment, external fixation or also internal fixation, we have the problem of that. So in introduction we have to say that fracture of the distal of tibia, the meaning of that involve diaphysis or metaphysis and either extra or mentioned as an intra-articular fracture that mentioned as a pilon fracture. One of the most challenging injury, elevated risk of a complication we had in pilon fracture. A number of the management and the guideline mentioned in the literature and by many of pioneers. Several recently described the surgical incision for this type of the fractures, but unfortunately we have the problem for pilon fracture. Less than 10% of lower extremity fractures we can tell in distal part of the tibia as a pilon fracture, and between the male and female we have more and male, and the age of that between 35 to 40 years old, and the mechanism of the high energy by that maybe by some things like airbag and seat belts maybe will reduce the chance of this type of the fracture and complication of that. There are many classifications that mention that when we review the articles that is very important. Several classifications as a points that we have to know that. Entirely extra-articular fracture, intra-articular fracture as a partial in the knee joint, and intra-articular complete intra-articular fracture. And by Rudy and also Algo were explained about that, and also we have AO classification of that, and in spite of all of that, we have to mention that we have three types as AO mentioned about that: type 1, type A, type B, and type 3. In type A, we can say that we have an extra-articular fracture, and in type B, we have partial articular pilon fracture, and in type C, we have complete articular pilon fracture. That we explained that in this slide, all of these forms together to explain the definition. And also in these slides that X-ray in AP and lateral showing that the type B, that is in intra-articular fracture and partial. AO classification that in this X-ray explained that the type of the radiology that our young colleagues needs in the casualty room, AP, lateral, and mortise view we need for the ankle, and also radiography of entire tibia and also the foot. Computer tomography scanning also help us very important, and three-dimensional also radiography is also important to knowing that how the osteochondral fragment are involved and how we could be able to fix it and making the alignment of that. These 14 points that now I have to mention that by radiography is very important. Points that I could be able to select it from the text and also review the article. So we have to know that these fractures are intra-articular extension or not, present or absent. Diaphyseal extension of that, metaphyseal impaction, articular surface impaction, present, central or anterior, or also in other parts, simple split fracture present, sagittal or coronal or oblique or absent. Number of articular fragments involve column medial or lateral posterior, and also fracture of a tilux fragment isolated from the lateral column, and also these others, medial malleolar fracture isolated from medial column, and posterior malleolar fracture isolated from posterior column, fibular fracture, alignment of the extremity in the distal part, shortening of that, and is there any air in the soft tissue or not. So we have to be careful for the soft tissue. We have to mention about the soft tissue. Soft tissue are more important than also with the bone. These fracture must be, it's not possible that we only mention about the bone. So my last sentence is important. The time for delineation of the status of the soft tissue may take place after 10 to 15 days. So it is not necessary that we do open reduction and or if the fragment as soon as possible, we make the alignment or not. One more sentence for that, what we have to do for the fibula. We have to get the fibula and fix it at the primary stage, or we have to delay that. So it's better that in soft tissue, we also mentioned that by Cheshire and also Austrian classification, grade 1, grade 2, grade 3, and grade O. In grade O, we have negligible soft tissue injury, grade 1, superficial abrasion and contusion of the skin and subcutaneous tissue. In grade 2, deep abrasion and continuous and contusion of the skin and muscle and risk of compartment syndrome. In grade 3, we have extension of degloving subcutaneous tissue and also severe muscular injury that we may have the compartment syndrome. So the value of this classification is very, very important because the message that mentioned by the author is that we have to support the soft tissue. So the meaning of the soft tissue also important in this system, abrasion or contusion or edema or skin tension blister. The meaning of the blister that we have the fluid inside of that or we have the blood inside of that. Though it means that it is more dangerous of the soft tissue or not. So as Gastillo classification about the soft tissue damage and open fracture, we have to know about in this part also. The initial management is making the alignment of that. There are three possible about that mentioned by our colleagues that. So the only things that I have to mention that the length of the alignment is important that some authors and also the AO mentioned that we need that making the fibula for fixation of that in primary stage and other that if we making the fibula for fixation of that then when we remove the external fixture and wants to fixing the alignment of the extremity and fixing the body, it may be difficult.
Conclude now.
Thank you very much. I will show my last slide. In conclusion, distal tibial fracture in the adult results from a combination of axial compression and rotation forces. Distinguish between the extra and intra-articular fracture, partial or complete one. External articular fracture can be treated by true minimally invasive technique that explain about that. A critical point in the management is clinical judgment of the condition of the soft tissue, consider the delay between the injury and definitive, or if the approach presented offer different options to the surgeon. The recent development of the implants have improved our ability to establish these fractures. Unfortunately, due to the primary articular cartilage damage at the time of the injury, well-performed surgery may still result in a poor outcome. Thank you.
Thank you.